Hello guys, how are you? Welcome to my YouTube channel. I am really delighted and glad to have you on board. My name is Victoria, and this time I'm doing a series of sexually transmitted infections. Today I'll be talking about syphilis. What is syphilis? It is not a virus like HIV, no. It's a disease that is caused by a bacteria. It's transmitted sexually, either through vaginal sex, anal sex, or oral sex. The disease develops in stages from a primary, secondary, latent, a tertiary form. And of importance for you to know is that there's a congenital form whereby, as a pregnant woman, you could transmit the disease to your unborn child while the child is still in your womb or during delivery. Now, once you get exposed to the disease, you develop a primary stage which manifests about 10 to 90 days after exposure. With the primary stage, you tend to have a painless ulcer, a painless rash that becomes an ulcer around the area that was involved, either around your vagina, your anus, or around your mouth. This ulcer, as I have said, is painless and normally disappears in about 3 to 6 weeks without treatment. Following this, 2 to 8 weeks after the disappearance of this ulcer, then you get into a secondary stage. In this secondary stage, the disease can affect any part of your body, can interfere with any system. Commonly, what we see on the outside is patients tend to have cutaneous manifestations. So you could find someone with a generalized rash, other rashes flat, others raised, maculopapular rashes, or loss of hair in some areas, alopecia, either loss of eyebrows, loss of beards, that is a possibility, or you get these syphilitic lesions we refer to as condyloma lata. These are grayish, whitish, slightly raised to flat lesions, which look like warts. So they could either be around your mouth mucous membranes, or around your vaginal area, or even around your anal area. Without treatment of this disease, from the secondary stage, there's a latent stage, and in the latent stage, there are no symptoms, but you have the disease with no symptoms. If a test was to be done, if a laboratory test was to be done, the likelihood is that the results are going to be positive. Now, the latent phase develops about 1 year after the secondary stage, or even at times less than 1 year after the secondary stage. When treatment is not applied, then you get to a tertiary form that's really fatal. So you could end up with neurosyphilis affecting the brain, could affect your heart, or the disease could infiltrate any part of your organ, any organ system in your body, and actually become very destructive. Now, the only way to avoid syphilis actually is faithfulness to one partner. Not the only way, there are many ways, but number one and most important thing is faithfulness to one partner. That really helps a lot, because if you're gonna be sexually intimate with this specific person, then the possibility that you're going to get the disease and transmit it to her or to him is quite low. And then the other thing is that treatment of a person who's been sexually intimate with someone who has syphilis. So that is why in a hospital setup, when we get a patient who ends up with syphilis, then we have to trace the people this patient has been in contact with, has had a sexual relation with, and we also treat them. We have investigations that can be done, and we have treatment for syphilis, mainly using an antibiotic, what we refer to as penicillin G. So if you have any of the symptoms I have described, do not be afraid, do not be stigmatized, be confident, take a step of courage, and come to a nearby healthcare facility where we will attend to you and you can be able to live your life to your full potential. For the youths out there, we are living in dangerous times where everyone wants to try out this thing called sex. If it's not your time, then please don't. Leave it for the grown-ups. we want to avoid such things. So otherwise, that is it for me. I wish you all the best. And if you haven't subscribed to this channel, please remember to do so. Thank you. If you have any questions or any comments, don't forget to put them up on my comment section.